Well, every parent wants to protect their children from harm and to keep them safe. And that includes keeping them safe from too much medication. And here to help us learn more about the Protect Initiative is Dr. Dan Budnitz, who is the director of the Medication Safety Program for the Centers for Disease Control and Prevention. Dr. Budnitz, thanks for joining us.
Oh, thank you.
All right, first off, let's jump into it. Tell us exactly, what is Protect Initiative?
Well, you may not realize it, but every year over 60,000 young children, 6 years old or younger, are brought to emergency rooms for medication overdoses. That's 4 busloads of kids coming in every day. But this doesn't have to happen.
Right.
So CDC got together doctors and nurses, pharmacists and poison experts, and drug manufacturers and other health agencies as well, to try to come together and figure out ways to prevent this from happening. Now what we learned was 90% of the time, kids are getting into medicines when no one else is watching them.
Makes sense.
Now, child-resistant caps are pretty good at preventing kids from getting to medicines,
Right.
but they have one key weakness.
What's that?
That's parents and other adults forget to put the caps back on and forget to lock them in nice and tight.
I see.
So we tried to come up with a way that you don't have to replace every time, something that's in the medicine bottle itself and doesn't have to be added every time.
Okay.
That's called a flow restrictor.
And tell us, what is a flow restrictor?
So a flow restrictor is a pretty simple concept. You take a large hole, that's typical for a medicine bottle,
Right.
and just make that hole smaller. Make it harder for medicine to come out.
Oh,
Some designs even include a valve
okay.
or a silicone stopper. Almost makes it impossible for medicine to get out.
And there's medicine in there right now.
There is.
Wow.
There is.
I
But what
see.
happens when you want to get the medicine out, when it is
Okay.
time to give the medicine? Well, a dosing syringe is a really good device to accurately measure medicine. But if you try to use a dosing syringe with a regular bottle, often it becomes quite a mess.
Right, I see the spillage right there.
Yeah. But with a flow restrictor, not only is it safer for kids, it actually makes it easier to dose the medicine for parents.
Oh, voila, no mess, look at there.
Without a mess, and also safer for kids.
Wow, okay, so how are the medicine companies, the manufacturers, helping to make sure that kids aren't getting too much medicine? From what I understand, there's some new standards.
That's right. Well, about 10% of the medication overdoses are because parents make mistakes. And a key culprit is the kitchen spoon. Now, you may know kitchen spoons come in all shapes and sizes. They're not made to dose medicines.
Because there's like the teaspoon, the tablespoon, the soup spoon, all that.
That's right. And if you actually grab a tablespoon, when you mean to grab a teaspoon, you can give 3 times more medicine than you
'Cause
intended.
that's the bigger spoon.
That's right. So what
Okay.
manufacturers are doing is a couple things. One is they're including dosing instruments with all liquid children's medicine, so you don't have to go to the kitchen at all. The second thing that manufacturers are doing is dosing in milliliters only and getting all spoons out of the dosing instructions.
So let's do away with the spoons and measure with the milliliter cup.
Exactly right.
Love it.
Exactly right.
And so from what I understand, there's also a campaign that teachers, parents, and caregivers that they've come together to talk about how to properly store and use medicines, like so the kids can't see them at all.
That's right. Kids don't just want to drink liquid medicine sometimes. They're attracted to pills and tablets as well. And so over here, I've filled half of these compartments with medicine
Right.
and half with candies.
Okay.
So I don't know if you can tell the difference, which
Well,
is which.
I was feeling a little lightheaded. I thought I had I don't know what this was earlier.
Well, if you look closely, you probably can tell one over here, one of these colored compartments is candy and one, though, is medicine.
Oh.
So it's hard to expect a 3 or a 2-year-old to tell the difference.
Wow.
So that's why we started the Up and Away and Out of Sight campaign, to keep medicines up and away from kids' hands. The first step, of course, is to use the child-resistant caps
Sure.
and lock those tight every time. The second is right after you use it, immediately put the medicines up and away and out of sight.
Right, because the kids are short. Like they can't see it. Like they can't get to it if if it's up high. That
That's
makes
right.
sense.
That's right. And the third tip is if you have visitors that come to your house, ask them if they have medicines in their purses or pockets, and if they do, put those things up and away and out of sight.
I love it. All right, so you've given us a wealth of information. If people want to know more, where can they go?
Well, if you ever fear that a child might have gotten into medicine, you can reach the National Poison Center, or any poison center, by calling 1-800-222-1222. Now, of course, if a child is not breathing or unconscious, you want to call 911 right away.
Immediately.
But we want to prevent this from happening, of course.
Right.
And to get more tips to prevent medication overdoses in young kids, you can go to www.upandaway.org.
All right. Well, it's all about the kids, and it's Dr. Dan Budnitz of the CDC bringing us important information on how to keep our kids safe. Thank you for joining us.
Thank you.
Yeah, this is great stuff. I would have never thought that all this was.
Absolutely, they are pretty neat.
Yeah.
Yeah.